All right, welcome back. Hope you're all having a great week. Today, we're continuing our RBT exam practice question series, where we're going through 10 RBT practice questions and breaking them down, how you should think about them on your actual exam. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. I would really appreciate it. If you're looking for our study materials, please check out rbtexamreview.com. We offer 3 full practice exams, a task list study guide, and of course our combo pack, which comes with the practice exams, study guide, and flashcards. It's our best deal. If you have any questions or comments, please let me know. I'm happy to help. Either email me, leave a comment below. We got a great review from Nancy, who recently passed her RBT exam last Friday. She was doubtful, but ended up purchasing the combo pack and said it was one of the best decisions she's made. She followed our advice of knowing the definitions, and I will stick to that till I die, that knowing your definitions and terms is the best way to get better at the exam. If you know your terms and definitions, the exam becomes 100 times easier. Okay. Nancy was able to pass with 10 minutes remaining, and now she's on to take her BCABA exam, which I'm very excited about. So congratulations to Nancy. Remember, whenever you pass, we want to know about it. Please let us know. Other than that, keep working hard, keep studying hard. Let's get to our questions. Question 1. Your BCBA asked you how the color identification program went with your client. You told your BCBA that it took the client 6 attempts, but they were able to identify all the colors correctly. What measurement system are you using? It's kind of a trick question. It's one of the lesser known or one of the lesser used measurement systems, but I think it's still important for you to be aware of it as an RBT. So you might learn something here, okay? So our BCBA asked us how our program went, and you said it took the client 6 attempts, but they finally were able to complete the program. So what measurement system did you use? Whole interval, percent of occurrence, trials to criterion, or latency? Well, you know you didn't use whole interval because we're not looking at a timing system here. There's no interval system going on. Okay. We're just simply looking at what? We're looking at how many attempts it took for a client to hit the desired target. And when you measure based on the amount of attempts it takes to hit the desired target, what is that considered? Is that called percent of occurrence? No, percent of occurrence is how many times a behavior happens given an amount of trials. So let's say we have 10 trials, the behavior occurred 3 times, our percent of occurrence would be 30%. We're actually looking at trials to criterion here, which is a way to measure how long it takes for a client or a person to meet a mastery criteria. In this case, our trials to criterion were 6. It took the client 6 times to be able to identify all the colors correctly. So what measurement system are we using? We're using C, trials to criterion. Y is in latency. Latency is the time in between the SD and the response. We're not measuring that. We're measuring how many trials it took to meet mastery. That is C, trials to criterion. If that's unfamiliar with you, that's okay. Maybe we learned something, but I just want you to familiarize yourself with this verbiage, trials to criterion. You might see it, you might not. What would be the most appropriate measurement system to use if the goal was to decrease the number of cookies eaten by the client per day? Back-to-back measurement questions. So if you've been studying a while, hopefully these are pretty easy to you. But in this case, what are we looking at? We're now looking to decrease a behavior, okay? We're decreasing the behavior. Remember, measurement can be used to increase, measurement can be used to be decrease, okay? In this case, we want to decrease the number of cookies eaten per day. And that per day is very important to this question. And why is that? Okay, pause for a second and ask yourself, why is that per day so important? Well, if you look at our answer choices, we have both frequency and rate. How are frequency and rate related? Well, frequency is just a component of rate. Rate is frequency over time. Frequency is simply our count. Rate is going to be our count with a time component added. So when you see that per day, or if you see per session, or if you see per hour, you know you're dealing with rate. If it was just reducing the number of cookies eaten by the client, we might use frequency because we would just count how many cookies they eat and kind of decrease that. But when you add the time component in, you're now dealing with rate. Don't get frequency and rate confused. They're similar, but they are not the same. So B looks like our best answer. We always read all of our answer choices. C, duration. Are we measuring the length of time for a response or a behavior? No, we're measuring how many per day. And then IRT. Be careful here. What is IRT? Well, IRT is inter-response time. It's a time in between responses. If we want to decrease the number of cookies eaten, what do we want to happen to the IRT? We, of course, want that IRT to increase. We want the time in between cookies eaten to go up. We don't want that IRT to go down. So be very careful with this question, okay? Be careful with IRT and understanding when you want to decrease a behavior, you typically want that IRT to increase. So in this case, if we want to decrease the number of cookies eaten per day, we're going to use B, rate. Graphing question. How would you describe the variability of data points 1, 2, and 3? I'm here to tell you, it's my mission to convince you that graphing questions are easy, that you should get these quickly and simply on your exam. And this is a good example of why, okay? In this case, you need to describe the variability of data points 1, 2, and 3. Well, what is variability? Variability is the change from data point to data point. If those data points are bouncing all around our graph, we're going to typically say there's a lot of variability. If those data points are moving a little bit, but not much, we might say low variability. If those data points aren't moving at all and they're flat, we're going to say no variability. So let's look at data points 1, 2, and 3. If we look at our x-axis, data points 1, 2, 3. What is the variability? Well, we just said if those data points aren't moving at all, we're going to have no variability. And that's exactly what's occurring here. By comparison, if we look at 4, 5, 6, and 7, those data points are jumping all around, right? We're going from 5 to 8, down to 2, up to 3. It's all over the place, okay? High variability, lots of variability, 4, 5, 6, 7. The question wants to know about 1, 2, and 3. Clearly, there's no variability. Those data points are as flat can be. Graphing questions, very straightforward. Make sure you answer what the question is asking, especially if you're given a graph. We have 7 data points. They want to know about 1, 2, and 3. Only tell them about 1, 2, and 3. Don't even worry about the other stuff on the graph. Miss Kim uses a star chart in her classroom. Her students are able to earn stars for various activities and good behavior. However, if someone gets out of their seat without asking, they lose a star. Losing a star possibly serves as a what? It's a very specific intervention we're looking for here, okay? If they are earning these stars, they're effectively earning tokens more or less, right? It's kind of like a token economy. But they're able to lose those tokens or those stars for bad behavior, maladaptive behavior. Losing a star serves as what? Is it going to be an antecedent? Well, no, losing a star is going to be in response to something, right? It's going to be a consequence of getting out of their seat without asking. So it's not going to be an antecedent. It's obviously going to be a consequence. We can eliminate A. Does it possibly serve as a punishment? Yes, that's the intent, right? Now, we don't know what happens to the behavior, but possibly it's going to serve as a punishment. That's the whole point of removing the star, is to reduce getting out of the seat, okay? So that word possibly is key, because it is possibly serving as a punishment. That really is the goal of this intervention. Now, what is this intervention called? Okay. Is it C, a response cost? Yes. What is a response cost? A response cost is the removal of an earned or a gained or possessed token or star or whatever you're using as your token. If you remove those in response in an act of punishment, you're engaging in a response cost. So what is our answer? Well, B was right, C was right. If we look at D, we see both B and C. That's what we're going to choose. Again, another good indication of why reading all of your answer choices is so important, okay? You want to know what's right, what's wrong. Pick the best answer. But if there are more than one answers, okay, try to find either the answer that lets you pick multiple, or again, you're going with the best one. In this case, this is response cost, and a response cost is a type of punishment procedure. You and your friends are in a group text together planning a Super Bowl party. The host sends a text asking everyone to name the dish they are bringing to the party. You respond by saying you will bring a buffalo chicken dip. Everyone in the group hearts the message. The host asking people to name their dish is a what? It's a behavior question. We're looking at MOs, SDs, consequences. In behavior questions, we need to identify what behavior we're looking at and who is the learner. The behavior we're looking at is the host asking people to name their dish. Okay. What happens after the host asks people to name their dish? You respond by saying you will bring buffalo chicken dip. What happens after that? Everyone in the group hearts your message. So you responding is the response, right? The antecedent, of course, is the host asking people to name the dish. And then everyone in the group hearting the message is the consequence. So we know we're dealing with an antecedent here, right? The host asking people is an antecedent. So if we look at our answer choices, we can eliminate D. Consequence is out. Can we eliminate prompt? Well, sure, right? We only have the antecedent. We don't have anything in between the antecedent and the response. Okay, remember the prompt comes in between the MO, the SD, and the response, right? The prompt is serves as a temporary SD, but there is no prompt. It's simply the host sending the text asking everyone to name the dish. So we can eliminate C. Now leaves us with MO and SD. Now, if you watched our video Monday, we talked a lot about MO and SDs. An MO is a motivating operation. It increases the value of a consequence. Okay, it makes you want to do something or not want to do something. The SD signals the consequences available. So the host sending a text asking everyone to name the dish does what? Well, it signals that a consequence or a reinforcer is going to be available for naming the dish. Okay, before the host sending that text, right? There's no indication that that reinforcement's available for engaging in that response. The motivation might have been there, right? It doesn't necessarily alter the value, okay, of that consequence, right? But it does say if you respond with your dish, there's going to be a consequence for that. And that's what an SD does. An SD is an instruction, okay? It's a command. It signals a consequence is available. When the host says name your dish, you know if you name your dish, there is now a consequence available, which in this case is everyone in the group hearting the message. The host asking people to name their dish is an SD. Again, MOSDs are a little tricky to understand at first. They can be complicated, okay? Make sure you review them. Slow down when you're learning them, okay? Go through questions like this multiple times until you really get a good grasp of what they are and the difference between the two. When planning for skills and behaviors and teaching skills and behaviors, ultimately, we want those skills and behaviors to do what? So your job as an RBT is implementation. You implement, you take data. We're teaching behaviors, skills. We're reducing behaviors, skills, okay? We're learning and unlearning behavior. After we teach the behaviors and skills, what do we want to happen, okay? That's what the question wants to know. Do we want those to regress when training stops? Well, of course not. Regression means they start to slip away, they start to fade, they start to decrease, okay? We don't want those behaviors to decrease when training stops, okay? We actually want the opposite. We want B, we want them to generalize and maintain. If we're not generalizing skills and we're not maintaining skills, okay, we're not doing our jobs effectively. It means nothing if our client can demonstrate the skill or behavior in our training environment, okay? Those things need to happen in the natural environment. So when we're teaching skills and behaviors, we want to be sure they're generalizing and maintaining. B looks like our best answer. Let's keep reading. C, remain on thick reinforcement schedules. Again, we don't want them on thick reinforcement schedules. Thick reinforcement schedules, okay, they mean you need to engage in fewer responses to receive reinforcement. Things like FR1s, FR2s, those are very thick schedules. You receive a lot of reinforcement for not a lot of responding, okay? That does not promote generalization and maintenance. So C is out. And then D, none of the above. Well, we said B is what we want, so we can eliminate D. Our answer here is going to be B. When we teach skills and behaviors, we want them to generalize and maintain. John is sitting at the table playing with his Legos. You sit down, hand John his math worksheet, and tell him to start working. John completes the first problem, plays with his Legos for a minute, then completes the second problem. You then take away his Legos, and John starts to scream. What would you hypothesize the function of this behavior might be? Okay, be careful. Don't just see this first or second sentence that says you hand John his math worksheet and tell him to start working. We need to look at what happens with the behavior, when the behavior starts. What is the antecedent to that behavior? Okay. John is sitting nicely playing with Legos. You tell him to start working. What does he do? Well, he completes the problem, starts playing. and then completes the second problem. So he seems to be working pretty fine, but then you take away his Legos. Only then does John start to scream. What is John doing? Is he trying to escape? Well, I wouldn't say he's trying to escape, since he was working fine until you took away what? Until you took away his tangible. Now he's screaming, okay, because we think, right, he wants to obtain that tangible back. It's not for attention, okay? He was working just fine. He was not screaming. Only when you took his tangible, I mixed up C and D. I apologize. I've got COVID right now, so a little foggy in the brain, but you understand what we're going for, okay? What would you hypothesize the function? We're going to say tangible, okay? We need to look at the antecedent to the behavior, okay? The consequence of the behavior to really start to guess the function. When you hypothesize a function, you're taking an educated guess, okay? Using the information available to us, John seemed to have no issue working. He only seemed to have an issue when his tangible was taken away. So our answer here is going to be D, tangible, okay? Presenting a stimulus in close proximity to another stimulus to try and transfer the properties of one stimulus to another is most similar to what? I used a lot of fancy words to try to throw you off, but just slow down and think about it. What are we doing? We're presenting a stimulus in close proximity to another stimulus. So basically presenting one stimulus together with another stimulus. We want to transfer the properties of one of those stimulus to the other. So we want to do what? We want to pair. We want to pair those two stimuli together. Very straightforward question, okay? If you get a question like this where it's a technical definition question and they're using technical language, just slow down and try to picture in your head what you're doing. You're presenting one stimulus close to another to try to share the properties of those two stimuli. You're just pairing, okay? We're not shaping. There's no approximations, no successive approximations. No prompting. We're not trying to evoke any sort of behavior. And we're not fading. We're not removing or systematically removing anything. We're just trying to pair one stimulus with another. If access to the client is unavailable at the moment, but your supervisor would still like to gather information on the client, what assessment will be best for you to use? Okay. The key here is what? The key is the client is unavailable at the moment. Meaning what? Meaning we can't directly observe or ask the client. When you can't directly observe or ask the client, what type of assessment are you engaging in? Preference assessment, indirect assessment, direct assessment, or a functional analysis? Well, you know it's not going to be a direct assessment because the client is unavailable. It's not going to be a functional analysis because a functional analysis is a type of direct assessment. Now, you can run some version of a preference assessment without the client, okay? But it's only going to be kind of an interview form, right? And it's not really going to be the most accurate preference assessment you can run. So the question wants to know the best assessment to use. An indirect assessment is going to be better than a preference assessment. A preference assessment is going to be better suited for when the client is actually available and you can get the client's opinion or you can observe the client actually engaging with the stimuli, okay? Running an indirect preference assessment is not going to be the best way to do it. Simply, you'd want to run some sort of indirect assessment, maybe an interview or a checklist, okay? Tricky question, right? You really need to read carefully and think about what the question wants to know, okay? The key is the client's unavailable. What's best? It's going to be B, indirect assessment. You don't need the client to gather data for an indirect assessment. What is the most appropriate response to a client's parent or stakeholder asking you, the RBT, to add to or alter the client's treatment plan? What's our rule of thumb, right? What does the task list say? Task list says RBT engages only in their competencies, right? Only what they're tasked to do, and they openly communicate with their supervisor. In this case, this might come up if you work in home where the client's parent or their stakeholder wants you to alter the treatment plan or change something about the treatment plan. How do you respond? You A, say, sure. What would you like to change? No. Okay. Do you have permission to alter the treatment plan? You don't, right? RBTs implement, we take data, okay? But RBTs do not change the treatment plan without first doing what? Without first consulting with the supervisor. So B, I'm not allowed to make changes to the treatment plan. While true, okay, this doesn't leave the client with much hope. If you just say, I'm not allowed to make changes, well, then what? What happens next? Okay. You can still present a better answer to the client. C, I've been wanting to make changes as well. What should we do? Now you're throwing your team under the bus, okay, and it's claiming you can make changes. That again is incorrect. So D, what would you like to change? I'll let the supervisor know and get back to you. I sound like a broken record, but I'm telling you, the exam is going to want to know that you understand that communication with your supervisor is key whenever asked questions by the client that are out of your skill set. Okay. The client wants to change the treatment plan. You just say, all right, what do you want to change? I will let the supervisor know and get back to you. Our answer here is D. Okay. Hope you enjoyed. Sorry for my voice. Again, battling a little COVID, but we'll be back Friday and Saturday with BCBA questions, and then Monday and Wednesday next week, more RBT stuff. Check out RBT Exam Review for all of our study materials. Questions, comments, please let me know. Other than that, work hard, study hard. See you soon.